Welcome to Legal Nurse Podcast. This is your spot to get inspiration, tips, stories, and guidance to help you in your legal nurse consulting practice. I'm Pat Iyer, the host of Legal Nurse Podcast since 2016. We are among the top 5% of all podcasts in the world in terms of longevity and sharing information consistently week after week with legal nurse consultants. Sit back, relax, and enjoy the show. Welcome to Legal Nurse Podcast. I'm Pat Iyer, and today we're going to focus on a topic that has an impact on you as a nurse and as a legal nurse consultant and business owner, and that is the issue of empathy and the possibility of being in a healthcare or work environment where empathy is lacking. The majority of the listeners of Legal Nurse Podcast are in the United States. We have listeners in 114 countries. And just yesterday, I was speaking to a woman in Canada who was telling me about this topic being so much of an issue in her country, as well as it is an issue in the United States. My guest today is Nia Renee, who I met at the National Speakers Association conference in the summer of 2025, and we started talking about her area of expertise. She is a trauma-informed leadership speaker, and she's also a certified narcissistic abuse recovery coach. And if you think about that series of letters strung together, you can realize that she has a focus on helping people who have been the victims of narcissistic abuse, which is something that nurses can identify with as an issue that we sometimes encounter in healthcare. And you might encounter it also with some of your attorney clients, hopefully rarely. Nia Renee has a focus on working with battered women as well. She is a coach and she leads workshops and consultations and works one-on-one with people who are struggling with some of these issues that we'll talk about today. Welcome to the show, Nia Renee.
Thank you for having me. I'm so honored to be here. It was such a pleasure to meet you in Phoenix and get to talk to you and just, talk back and forth about what makes us happy and just doing the work that we do. So thank you so much for wanting to have me on your podcast.
You are welcome. I wanted to focus, first of all, on the term empathy in the workplace. It is something that we are talking about, we are more aware of. What does that mean to you? And what should that mean to the person who's either watching this podcast on our YouTube channel or listening to it on audio channels?
Yeah, of course. That's such an excellent question. I think empathy in the workplace is very important, and it's something that I'm stepping into more of my focus when we're talking about my speaking platform. And so I like to call myself the empathy powerhouse, redefining leadership through compassion and strength. And empathy in the workplace is the ability to recognize, understand, and respond to the emotions and lived experiences of colleagues, staff, and patients. And it's something that goes beyond sympathy. It's not just feeling bad for someone, but actively acknowledging their humanity, validating their experiences, and adapting leadership or care practices to meet both professional and emotional needs. So in healthcare, empathy is the bridge that connects clinical skill with compassionate care. And it's so important in healthcare. I mean, I am a 6-time brain surgery survivor. And just having to be in the medical system as much as I've been in, there's only been a small amount of people that I've experienced compassion and empathy from. And so I think that it's very important in the workplace because it really sort of controls how we interact with other people.
So I want to be sure that I'm clear in what I heard. You have, as a patient, experienced compassionate empathy only from a small portion of the nurses, or a small portion did not have it?
A small portion of the nurses that I received empathy and compassion from.
So a small portion
Nurses,
didn't.
doctors, and it's but a larger portion didn't exhibit those or exude those
Ah, okay.
characteristics. Yeah.
That's disturbing
Mhm.
because we as healthcare providers want to believe that our colleagues and that we deliver compassionate care. How does that manifest to you as the patient when you didn't receive the compassionate empathy that you needed at that time?
Yeah, it really took me to a dark place. It kind of reminded me of my childhood, not being seen or heard or believed, and being looked at in a certain way when you're dealing with some things that are, especially the things that I was dealing with, which was potentially life threatening. I would say I experienced it less from nurses and more from the practitioners. I think I experienced more of like medical gaslighting and medical mistreatment from doctors and practitioners than I've experienced with nurses. I think with nurses, I've experienced an extreme level of compassion and empathy. But then there were some times that I didn't. I kind of got the cold shoulder, or there wasn't really much of a rapport there. And it made my experience lonely, especially being in the hospital for 10 days, and just dealing with so many different people and personalities, and the ones that show up without compassion and empathy were the ones that made my journey a lot more difficult and aided in me feeling very alone.
And for our listener who's not familiar with the term medical gaslighting, I want to make sure that we define that before we go on.
Yeah, so medical gaslighting is where essentially the medical professional is causing the patient to feel like they're crazy and that they're questioning their own reality in events of what's happening to them. So, for example, I have three brain conditions, and I was told that I was making it up in my head when it was quite literally in my head.
Right. Yeah, that's what brain conditions are. It can't be in any other part of your body.
Yeah,
So you were either directly accused or somebody implied that this was not a real condition
correct. Or
for
that I
you.
wasn't experiencing the symptoms that I said I was experiencing, or that the condition didn't have the symptoms that I was experiencing, or that they'd never seen a case present itself the way that my case presented it.
There has to be a first.
Unfortunately, I've been many.
Yeah, that's not a good place to be in. In these situations, you've talked about how it made you feel lonely. And can you think of a specific interchange other than what you've just shared where a provider came across this way to you as a patient?
Do you mind rephrasing the question?
Yeah, tell us about a situation that you encountered where you experienced this type of lack of empathy.
Yeah, there. So I was going through. So I have the brain condition that I specifically experienced a lot of this with is called Chiari malformation, Chiari malformation, and it is not widely believed by neurologists, by neurosurgeons, by the neurological community. And so it is automatically dismissed by saying that it is, what's the word I'm looking for? Incidental. It's an incidental finding. It doesn't actually cause symptoms in the body. And so that's where I was constantly questioning my reality of like, well, what am I like? Is this really happening to me? Am I really making this up? And it turned out that I had millimeter herniation in my brain that was pushing into my spinal canal that ended up getting to 7 millimeters by the time I had my brain surgery. And by the time I had my brain surgery, my brain was swelling and I could have died. But I was being dismissed for years. Even like I had my records pulled from Kaiser Permanente. And in 2016, they did an MRI and they specifically noted no, no Chiari malformation is not present. But then I was diagnosed with it in 2019. So even down to radiologists,
Mm-hmm.
they don't believe it. This is a rare brain condition where you have to fight the medical system every step of the way. And it is incredibly, incredibly unbearable.
Mm-hmm. I have a colleague whose husband has that condition, and I know that I've seen it described in a few medical malpractice cases where it was misdiagnosed and improperly treated. I'm sorry that you have gone through that. I know I can't do anything to fix any of that. It's a, a poignant example of what a patient experiences when there is a delay in diagnosis or a misdiagnosis. And if we take it out of that realm and we bring it into the workplace environment between colleagues, which is another whole aspect of treating each other with empathy, what we hear reports about, either from people who are working in the field or patients who want to file medical malpractice cases because of a lack of empathy, is a lot of reports of apathy, hostility, burnout that affects the workplace environment. Can you tell us a little bit more from your work in that field? What's the impact when people are not getting along well?
Yeah, so I think an environment without empathy, it feels cold and transactional and unsafe, and communication becomes top down rather than collaborative. And I think individuals feel invisible or reduced to their productivity, which leads to fear, mistrust, and burnout that spread quickly. And because people sense they are valued only for output, not as human beings in healthcare, this lack of empathy creates not only a toxic workplace, but it also impacts the quality of the patient care.
Yes, since you and I talked in Arizona this summer, I heard a nurse who was quoting a defendant nurse who was deposed. And the attorney asked her if she was aware about the patient's deteriorating condition. And she said yes, and I didn't care.
Gee,
Not the right answer.
no, not even close.
It's going to follow her into the courtroom if they can't settle this case. The jury
Wow.
would be appalled. Rarely are people that blatant. They may pretend that they cared. I got involved helping to defend a doctor many years ago who was being sued by a nurse. The patient was agitated and pulled her stethoscope out of her ear, and she had a cochlear implant in her
Mm,
ear that was ripped out
mm,
when the stethoscope was pulled out. And she sued the doctor under the theory that the doctor should have ordered sedation. And apparently, when she told the doctor about the patient's behavior, he said to her, well, maybe he just didn't like you.
mm.
And the tone that he used at the time, by the time it got to trial 3 years later, He was able to transform this whole interchange of, he was the caring and compassionate physician, and all the flippancy and the sort of the coldness of that response dissolved with time.
Mm.
I was hired by his attorney. I could truthfully say that it was the nursing responsibility to contact the physician to request orders, and she hadn't. And I could defend the lack of liability on his part, but I didn't get into this whole comment about, she said, he said it in a certain way, and he
Mhm.
said no. Those are the kinds of things said in the moment of stress or distraction or anger that leave a lasting impression, as it
Yeah.
did with this nurse, who was very clear about what he said to her. The jury did not find the doctor negligent, by the way.
Mm.
Her lawsuit was not successful at trial. And as we think about that response, and we think about the dynamic, I think what you've pointed out is how important it is to treat each other with civility and not with apathy or hostility.
Right.
Healthcare has focused a lot on bullying behavior for
Mm.
quite a while. I'm not sure that I would characterize what that doctor said to the nurse as being a bully. There's more blatant behavioral symptoms than that. Tell us a little bit about how we can spot the bully and we can differentiate the bully from the apathetic person.
Yeah, so there are some signs and symptoms of bullying behavior that are very important and things to pay attention to. Public humiliation or belittling remarks, exclusion from important conversations or opportunities, micromanaging or setting unrealistic expectations, withholding information needed to succeed is a really big one. Gossip, of course, gossip is plagued in every single workplace. There's always going to be gossip. That's just something that we're not going to escape. Spreading rumors or undermining credibility, and consistent patterns of power being used to intimidate rather than support are just a few. And I think when we look at the landscape of healthcare, it is important to remember that there should be that patient first mentality. And if you have that patient first mentality, all of these other behaviors shouldn't exist. They shouldn't exist because all of these behaviors have the potential to fall into patient care because you don't just stop those behaviors when specific people are around. Those behaviors follow you everywhere. So when we look at that landscape, there needs to be changes in calling out that behavior immediately and putting a stop to that. But that requires leadership to not be a part of it as well. That requires leadership to not be gossiping and spreading rumors, micromanaging, setting unrealistic expectations. But I've experienced in my own career leadership gossiping. And it like, get it together, guys. Like, that's all I can really say in the most professional way is get it together. What are we doing? But when we look at the landscape of healthcare, I think when we look at the landscape of businesses in general, if we're customer first, if we're supposed to be customer first, customer oriented first, then we have to nip in the bud a lot of behaviors that we project.
And it's a real challenge. One of the companies, for-profit companies called the Joint Commission that accredits hospitals in the United States, has put this bullying behavior in its laser focus. And several years ago, wrote a regulation that said that the hospital will have zero tolerance for bullying. The problem is that the physicians who are bullying are the food chain for the hospital. They decide where they're going to admit their patients. They decide where they're going to do their surgery, whether
Yep.
it's inside or it's an ambulatory surgery center. They bring in the dollars,
Mm-hmm.
and their behavior for a long time, bullying behavior, has been tolerated.
Hello, I'm Barbara Levin, past president of the American Association of Legal Nurse Consultants, and I'm also a medical surgical and orthopedic nurse expert. Pat Iyer and I are working together to bring to you our 12th LNC Success Conference. This is being held November 13, 14, 15, 2025. We have some amazing speakers that have worked on a variety of cases. One of the sessions that I will be working on has to do with presenting to you a workshop on analyzing medical records. So you will receive some medical records in advance of our conference, and together we will work on analyzing this case. You will also hear from Dr. Jeff Willis, and he will talk to you about case analysis as well. During my session, you will actually work on a case, go into a breakout session, and share with all of us what you learned from your review of the medical records. So you will actually have an opportunity to gain some hands-on experience. This is what's so different about Pat's and my conferences versus other conferences that we're aware of. So we invite you to join us November 13, 14, 15, 2025. Please see the link below, lnc.tips/NOV 2025.
When you start talking to nurses about bullying physicians, everybody's got a story of a situation. I worked with a neurosurgeon who threw surgical instruments at nurses in the OR when he didn't find things were going his way.
My goodness.
I know of surgeons who have injured people in the OR with their flying instruments, including anesthesiologists. One person who was no longer able to practice medicine because of the damage to her hand from somebody who threw an instrument and managed to hit her just right. I have had the opportunity to teach about bullying in Australia in an international audience. And when I raised my hand, I said, raise your hand if you've experienced this. And nurses around the world, Italy and Philippines and India and Australia and New Zealand, they're all raising their hands. Yes, we know bullying behavior. This is not confined to one country. And I can't help but want to pull from you the concept of the power dynamic that we're talking about. Nurses in particular are targets of this. Tell us about the power dynamic between nurses and doctors and how that helps to make this a persistent problem. Despite the regulations, it's still there.
Yeah, of course. Excellent question. Power imbalance creates vulnerability, and when doctors hold authority not only over patient care, but also over how nurses are perceived, it can foster a culture where nurses' voices are dismissed or minimized. And if unchecked, doctors may misuse their authority, interrupting, belittling, or punishing nurses for speaking up. And this dynamic silences nurses, reduces collaboration, and it ultimately compromises patient safety. And so but how do you stop the bully when the bully is the leader? Like, how do you stop the bully when there's that power dynamic of the doctor and the nurse? But I think there needs to be a safe space to be able to discuss those interactions. But it's really difficult when you're the nurse that's receiving that behavior and you're afraid of the repercussions of speaking out, because that's also prevalent in the workforce, is fear of retaliation, which many companies lead with zero tolerance for retaliation. But do we really stand by that? Do we really stand firm in that?
That's when the physician marches down to the nursing office and says, I want this nurse fired because she didn't do what I told her to do. And the nurse manager has to take a stand and support the staff in the face of an angry physician.
Mm.
That's when nursing leadership needs to take a position. This issue also is hidden in medical malpractice cases when there is lack of communication, when nurses are afraid to contact a physician about a change in a patient's condition because the physician is going to be abusive.
Mm.
And it puts the nurse right in the laser light of the physician's anger at being called at 2:00 in the morning about a significant change. Don't bother me. Why are you calling me? When attorneys start exploring this in depositions with nurses, they can find out a lot of information about a physician's typical pattern. And if it's abusive and bullying, it is not going to go well for the physician in terms of that lawsuit. Do you have any thoughts about that?
I think that physicians should be held accountable. And I think that, I mean, we see it normalized in the media. I mean, I love Grey's Anatomy. I really do love that show. It's been a show that's been around for a long time, but you even see it in that show. You see how physicians treat nurses. You see how they talk down to nurses and belittle nurses. And from my opinion, the nurses are the ones that are doing 90% of the work. When I was in the hospital for 10 days, I saw the nurses around the clock. I saw a doctor one time at 6:30 in the morning being groggy on my medication and barely remembering the interactions. But every single interaction that I had after that was with the nurse. And so I think that nurses deserve to be treated with respect. They shouldn't be met with an abusive environment. They shouldn't be met with a physician who is unwilling to work with them, who has a superior complex, who has a God complex because they may be a surgeon or they're a doctor, right? They're someone who is getting paid the big bucks to do not very much of the heavy lifting. And I'm not downplaying physicians. I'm not downplaying their position that they play. I'm not downplaying the work that they did to get to where they are, the years and years and years of schooling to get to where they are. But I don't think that excuses the behavior that precedes them.
What you're saying reminds me of that expression also of kick the dog. Patients increasingly are not showing respect to physicians and feeling comfortable being abusive in their communication. And then the physicians, in turn, are abusive to people in their environment. And then the nurses, who are the targets of anger, can turn on new employees, new hires, new graduates, making them feel uncomfortable. We can spread toxicity very quickly in a healthcare environment. I'd like to wrap up to focus on some of the strategies that we can use to help tackle this problem, because certainly we've talked about the challenges and the implications. What do we need to be focused on ourselves in terms of handling the topic of abuse, apathy, hostility, how can we respond?
Yeah, I think there are a few really good ways that I usually tell my clients, and my corporate clients as well. One of the biggest things is the top thing is setting boundaries clearly. Name the behavior and state what is acceptable. Stay calm and grounded. Don't match their aggression, but don't minimize your own needs. Oftentimes, they're looking for a reaction. A lot of times they're looking for you to say something back that can get you in trouble, and they can try and use that against you. So staying calm and grounded is very, very important. It's hard to do in the face of the way that our bodies respond to trauma and the way that our bodies respond to abusive behavior. Um, but calm and grounded is important. Documenting interactions. I have my bachelor's degree in criminal justice, and this is what I tell all of my clients. Document, 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 document. Keep a record to protect yourself. Document every interaction that you possibly can with who might have been witness to this. And you are able to create and establish a pattern of behavior. That's so important. And then use your systems your support systems, involve HR, go to your supervisors, use your employee assistance programs when needed, and prioritize your safety. If the environment becomes harmful to your well-being, recognize that it may not be a place to stay long term. And that is like that's not always the best decision to make, of having to leave a work environment because of someone else. But if you're in a situation where there are the extreme power dynamics, you have to do what's best for yourself. And so recapping is setting boundaries clearly, stay calm and grounded, document interactions, use support systems, and prioritize your safety.
Those are excellent points. And although we've been talking about this primarily in a clinical framework, as I said in the beginning of the podcast, occasionally, I would say rarely, a legal nurse consultant will encounter an attorney who is abusive, screaming, complaining. Usually it's something related to the billing on the file. I have been the target of some of those phone calls over the years, usually once or twice a year. It seems almost unavoidable, where it can catch you off guard, and you do have to follow those guidelines that you just shared. Safety is usually not an issue because it's usually over the phone, but setting boundaries, staying calm, not reacting in kind, not retorting and retaliating, trying to buy some time to investigate the situation, to understand why the other person is upset, and promising an investigation. That has worked for me to reduce the amount of emotion that the other person is projecting over the phone. And then going back to that client and explaining, here's why the invoice was the size it was, and here's where we told you we were going to spend more time than you might have expected because of these factors. We had that discussion. You said, please go ahead and spend the time you need, but now you're complaining about the invoice. So let's revisit that and discuss what we can do to make this work. That kind of calm response rarely can you do in the heat of the moment, just like in a clinical environment when a physician is yelling at a nurse or a nurse is yelling at another nurse, where you just gotta bring the temperature down so that people can hear each other and respect each other.
Right.
As the basis of
Exactly.
working with a colleague. Other people are observing and hearing that confrontation, and that's pretty messy.
Yeah. Agreed.
I know that this has stimulated some thought in the people who are watching this podcast. They'll want to know how to reach you. Now I can call you Dr. Nia Renee, now that I know you have your doctorate in criminal justice.
Oh, no, I don't. Just my bachelor's degree.
Okay.
Yeah.
Then
One day I'll be a doctor. One day
day.
I'll get my doctorate.
What would be the best way for them to reach you?
Yeah, so you guys can, if you want to reach out to me to work with me, or you're curious about what I do, you can reach me at info@howtoloveabatteredwoman.com, or you can follow me on social media at Coach Nia Renee, or you can look at my website www.howtoloveabatteredwoman.com.
And Nia is Nia,
Mm-hmm.
and then Renee, Renee.
Yep.
I appreciate so much what you have shared with us today. You have stimulated my memories and thoughts about being in these situations. And I know for our listener, this is something that, as nurses, puts us into a real dark place, because we came into healthcare to help people. None of us wake up in the morning and say, who can I make miserable today?
Mm-hmm.
We want to spread compassion and caring, and it's hard when our needs are not being met. And then that gets translated into the way that we interact with patients. And then in the litigation system, our listeners know where that can lead in terms of lawsuits. Even if the patient doesn't sustain any physical injuries, there are multitudes of people who contact plaintiff attorneys and say, I wasn't treated well. They ignored me. They didn't answer my call bell. The attorney has to sort through, all right, well, what do you think happened because of that? Well, I didn't like the nurses, but we can't file the lawsuit because you didn't like the way you were treated. There has to be something much more concrete. So there's a lot of that legal nurse consultants don't see, because all those cases are sifted out. Those unhappy people, the ones who have more concrete physical damages, are the cases that we become involved in. So I'm glad that we're talking about this in relation to litigation, so that our listener understands the importance of drawing on experts like you and thinking through what can happen when the lack of empathy and the hostility can indeed impact patient safety and results in injury to the patient. That's where we live. That's our lane.
Yeah.
Thank you for being a guest with me.
Thank you for having me.
And thank you to you who's come to the end of the podcast with me. I hope that this has stimulated some thought for you and made you take a step back and look at this issue and be able to implement some of Nia Renee's suggestions if you get into a situation where you need them. Be sure to go to podcast.legalnursebusiness.com to get the show notes for this show, and also to sign up to receive the prior recordings. We have them grouped into categories now so that you can do some deep dive into specific aspects of legal nurse consulting based on your needs at the time. And hang on for just a few more minutes to find out who's coming up next. Thank you so much. In this episode of Legal Nurse Podcast, I'm pulling back the curtain on one of the most effective ways to grow your legal nurse consulting business, presenting to attorneys. You'll hear why presentations can open the door to new clients, how to craft a message that attorneys actually care about, and what you can do when nerves threatened to take over. I'll share practical tips from warming up your voice to handling tough audience members to projecting confidence even when you don't feel it. And I'll include some stories about the nursing home administrator, for one, who completely lost her audience and how she turned things around the following year. If you've been avoiding public speaking or aren't sure how to turn presentations into real cases, This episode will show you how to build confidence, connect authentically, and win clients. Tune in and discover how to make your next presentation the gateway to your next attorney relationship. Thank you for being part of the Legal Nurse Podcast audience. I'm delighted that you've joined us for this episode. Be sure to go to legalnursebusiness.com and get your free reports. Look around the website, pick up some tools that will be useful for you in your legal nurse consulting practice. And be sure to join us for the next episode.